Leg pain, numbness, tingling, going down your leg may be feeling weak. Do you suffer from these symptoms? Do you have spinal stenosis? Are you scared on what's going on? Are you confused? Watch my video today. I'm going to explain to you why these leg symptoms are occurring, what's actually occurring. I'm going to explain to you what you can do to help manage this a little better, and I'm going to give you some clarification on this so you're not living in fear. Watch my video as I explain everything to you today. My name is Dr. Ali Shariff. I'm a local chiropractor in Oshawa, Ontario. My clinic name is Infinite Healing Chiropractic and Wellness Center. And our mission on this channel is simple. It is to help teach you how to optimize your health, how to live life to the fullest, how to live life without invasive procedures or surgeries or pills to start maximizing the inner potential you have. So watch this video in its entirety. If you're interested in learning more about your health and how you can maximize your potential, then subscribe to this channel, like this video. You will be informed on when I actually post out new videos. This is all about you and about living your life. So if you're interested in maximizing your potential, watch this video in its entirety. Let's start. So let's understand the understanding of why I'm getting these leg symptoms. Let's understand that nervous system first. We know that the brain connects to the body, and the brain connects to the body through the nervous system. So the spinal cord is running down the spine, and the nerves are exiting the canals right here. They're called foramina. But what can happen is that you got to think about your nerves as like hoses, garden hoses, where water is flowing through them. And that's that nervous system is being connected out to the whole body. Now, if that hose gets kinked, if that hose gets pressure on it, then suddenly that flow of information gets affected. Well, that can happen through this too, through a condition of spinal stenosis and stuff too. The canal where the spinal cord is can start to get narrowed. So that spinal cord can start to get compressed. But the foramen, where the nerve comes out of, that can also get compressed, okay? And so that narrowing, that's what stenosis is. Narrowing can start to affect that area. When it starts to affect that area, well, these nerves, you got to think about it, in the lower back, they actually go down your leg. They help with your leg function, everything your leg does, everything your leg perceives. So now, if that nerve is impaired, that means those abilities will be impaired. So that means that you may not be able to walk as well. You may have trouble walking. You may start getting symptoms. You may start getting numbness, tingling, lack of sensation. You may start getting pain radiating down the leg, if not both legs. You may getting a shooting right down to the foot. You may get positioning issues. You may get gait issues. You may also get fatigue. Your legs get tired really easily. All these symptoms could be occurring when these issues are occurring in your spine. So what does this mean with regards to your legs? What are you going to be feeling? You could be feeling aching in your legs, cramping in your legs, heaviness in your legs, tingling, pins and needles, numbness, weak, tired legs, fatigue, okay? And this could be occurring gradually, okay? It could be getting worse with standing for long periods, walking for long periods, and you could find that you feel a little better when you're sitting, bending forward, leaning, bending forward, kind of like that shopping cart sign. And what I mean by that is that when you have a shopping cart in front of you and you lean forward, it feels a little better. These are signs and symptoms of spinal stenosis and neurogenic claudication, which means nerve-related fatigue. Now, when you're getting these symptoms, it's important to understand, are you getting weakness because your muscles are truly weak, that you've lost this muscle strength, or is it a perceived weakness? And what I mean by that is it due to something else? Is it due to your nerves being irritated? Your muscles are fatiguing now. The circulation is being affected and stuff. And so this condition, when it comes to spinal stenosis, could be something that may not be permanent. It could be something that could be reversible and could be improved with care. So one of the things that people always talk about is that my symptoms are not consistent. They come and go. It's not always the same. Some days are good, some days are bad. Why? Well, it's due to a lot of different factors in there too. Inflammation in your body. It's due to your sleep, the posture of the sleep, the quality of the sleep, the type of sleep you're getting, your stress, how your stress levels are. Are they high? Are they low? Your activity levels. Are you working? What type of work do you do? Are you a PSW? Are you a construction worker? Your posture, your positioning, your nerve tolerance on that day is really affected by what's happening to you on that day. So that's why it can change day to day, and it may not be consistent. And that's an important thing to understand. So then the question is, what is normal and what is not normal? When should I be concerned about this? So what's normal with a spinal stenosis, a condition like a conditional spinal stenosis, is leg pain that gets better with sitting. That's a good thing, okay? Leg pain that gets better with your leaning forward. That's a good thing, okay? Heaviness that gets better when, heaviness in your legs that gets better with rest. Your symptoms are dependent on your positioning, okay? So certain positions do alleviate it, okay? When does it become a concern? Well, when you're getting weakness, increasing weakness, and rest is not even helping, okay? When you're losing coordination, and it's happening more and more, frequency of coordination, loss of coordination is increasing. Your symptoms are becoming more and more consistent, and they're not decreasing in any way. Bowel bladder issues, if you're having bowel bladder changes or issues or concerns, these are red flags that you should go see a medical practitioner and get this further assessed. So then the next question is, what can be done for spinal stenosis? How can I manage it better? Well, one of the things I always talk about is the chiropractic adjustment, how that can help you and stuff, and what I do. And one of the things I use is what's called a Thompson leg length check for any patient that comes in to see where I need to adjust. And I'm gonna show you right now what I do for a Thompson leg length check and how it can influence spinal stenosis. Okay, so today what I'm going to show you is I'm going to show you the drop piece adjustment. This is a great adjustment to do. In this adjustment, the patient is pretty much laying on the table. This is the position they're going to be in. There is no moving onto their side. There is no twisting, none of that. And so patients that have sometimes gotten the manual adjustment and they're not a big fan of that, going onto their side, they really enjoy this because they're just in this one position, they are relaxed. And I just come in and I adjust them, and I'm using the drop pieces in the table. This table has air drop pieces in there. So basically what happens is that you'll feel the table pop up and pop down as I'm adjusting you, and the drop piece absorbs all the impact. It's an extremely gentle way of adjusting a patient. So now we're gonna show you how I actually do this. So the first thing I'm looking at is leg lengths, and this is a very important indicator to show me where I need to adjust and how I need to adjust. And it's great because when a patient comes in and I have to recheck and see if I adjusted the last place or if I adjusted a spot and did it hold, I'd be able to recheck and see, am I adjusting that same spot again, or is there a new spot that's opened up that I need to adjust, or is that adjustment holding? So it's a great analysis technique to have. Now, when I come in here, the first thing I'm looking at is the leg lengths. When I'm looking at the leg lengths, I'm looking at the bottom of the shoes, and this part of the shoe right here is the part that doesn't erode. And so that's what I'm using as my indicator. So I'll get in there and I'll start to look and I'll see if one leg is shorter than the other. And you can see from this that this leg is shorter than this leg, okay? So that's an indication right now that we have a left short leg. Now, the next step is understanding that we have a left short leg. I want to flex the knees and see what happens to that left short leg. Does it stay short or does it get longer? So, and sometimes it may stay even. So let's see what happens, okay? Well, if you look at this, you can see how that left short leg actually becomes longer, okay? And so when I see that's become longer, it's gone from short to long. So when that happens, I know that my presentation here is the pelvis, okay, the ilium, and it's actually gone posterior. So my adjustment is going to be to this specific area, okay, to help to bring that back into alignment. Now, you'll see I crossed one leg over the other, and the reason why I crossed it over the other is it helps to gap the joint. It makes that adjustment a lot easier. And then I place my hands on here, and then I'll adjust through. And that is your pelvis adjustment. Now the next step is, let's check the leg lengths and see if they've changed. So now let's check these leg lengths and see how they've changed after the adjustment. You can see how they become level now, okay? So that means we have adjusted that pelvis. We want to double check with bringing the knees up. And again, see how it's a lot better, okay? That is a change that's been made to that nervous system, okay? And so we have adjusted that pelvis area. So the next part of the adjustment is going to be the thoracic adjustment, and we're going to use the drop pieces for this. So again, the drop piece will absorb all the impact. I will adjust the table settings so that only the thoracic area comes up. And what I'm gonna do is I'm gonna find where I need to adjust. And then once I've found that, the drop piece will absorb the impact as I adjust that area. Beautiful. So now I'm gonna show you how I adjust a cervical spine with the drop pieces and stuff. So I'm gonna get my patient to turn his head to this direction, okay? He's gonna stay in that direction. I'm now gonna adjust the drop pieces accordingly. So only the upper thoracic part and the cervical part actually come up. Great. And once we've done that, I then come in, I find where I need to adjust. I pretty much have contact on that area. This hand is just gently on the head, and then I adjust through. So hopefully I've given you some insight on what the leg symptoms are, how you're getting them, why you're getting them, but more importantly, what's common, what's not common, what's a red flag, and what can be done to help manage it better. So I would encourage you to like this video, subscribe to my channel, because I'm going to keep on putting more videos out to help show you how to maximize and optimize your potential. My name is Dr. Ali Shariff. I'm a local chiropractor in Oshawa, Ontario. My clinic name is Infinite Healing Chiropractic and Wellness Center. I'm looking forward to seeing you on future videos.